record this?
Sure, no problem.
Okay. Okay. All right. Well, since we're recording and it's 101, I'm going to go ahead and start here for people to see it later if they'd like. Today we are speaking with Daniel Toshio-Harrell, PhD, and Dr. Mustafa Abdul-Moheeth. Unfortunately, is it Dr. Anjum Khurshid?
Yes.
Yeah, okay. Unfortunately, he won't be joining us today, which is fine. We're all busy people. Myself, my name is Ryan Wright. I am the Blockchain and Healthcare Today ambassador for Missouri, one of only in the Midwest. And Blockchain and Healthcare Today is an international journal with the mission to share research and experiential knowledge through a peer review process. The journal is open to the public and easily accessible at Blockchain and Healthcare Today. The Missouri chapter is responsible for sharing this knowledge and onboarding any organization interested in becoming a member of Partners in Digital Health Initiative. And you might want to look out for the 2022 symposium on September 15th in Austin, Texas. I assume maybe you guys will be there. You're in Austin, maybe. Now, I'll introduce each of the people here. We've got Dr. Mustafa Abdul-Moheeth, and we also have Daniel Toshio, PhD. Excuse me, I keep wanting to call you doctor. And we are here to speak about their Medilinker project that was described in 2 papers in the Blockchain and Healthcare Today journal review of the 2021 Con V2X, but I believe your paper came out after that. It was published in March. Is that correct? Okay.
Yes.
So their paper, they have 2 papers for a Medilinker project. One is the design and the other is the use and the outcome. And I'm just going to describe real quick. First of all, let me let you guys go into a little bit more about your introduction. I'm sorry. Why don't you go ahead, Daniel, and tell me how did you intersect with blockchain and medicine at the same time?
So thank you for having us. My name is Daniel Toshio-Harrell, and I'm a research associate at the University of Texas Dell Medical School. And I got into blockchain research by trying to find a solution for patient-centric records, because in the United States, it's a very federated model where data is isolated in institutions and very hard to navigate for patients, particularly if you visit multiple clinics or specialties. And so given that fragmented model that is present, we thought that a blockchain or decentralized model would be a good architecture base to bring a patient to the center of their health continuum of care. And so that's how I got involved in blockchain at Dell Medical School, and we've been working on it for 3 years now, and we got it to a pretty good point.
Now, is there a blockchain program, or are you guys doing this research kind of by yourself? Like you went ahead and they're like, okay, well, we're going to do blockchain with medicine, or is there a certain research group other than yourself, like another hierarchy?
So there is a research group that's headed by Professor Khurshid, who's the PI on this project. That's the Blockchain and Healthcare Lab. He also does the data science as well as the HIE, or Health Information Exchange implementations for Central Texas. And so there is a academic group at the Dell Medical School, but also coordinates with medical residents, as Dr. Abdul-Moheeth is our kind of medical perspective. We also coordinate with electrical engineering departments, design departments at the School of Information to make it a cross-campus endeavor. So it's a big.
I think that's great. Dr. Mustafa Moheeth, do you have anything that you'd like to add about yourself?
Sure, similar to Daniel, a short introduction about myself. I'm a third year internal medicine resident here at Dalton Medical School at the University of Texas at Austin. And I got involved with the Medilinker group. I think it's been about a year and a half now. I, similarly to Daniel, had experiences going through medical school and now in residency with interoperability in healthcare, transitions of care, which are a huge source of inefficiency in our current healthcare system. So looking into potential solutions, blockchain had so much potential, and I'm grateful to have had the opportunity to join the Medilinker group for the past year and do some more research to hopefully take some of these theoretical aspects and bring it to the clinical world.
That's great. It's great. Yes, you're right. The service line in hospitals is very fragmented. Health information exchange is hard. And although there are the fast interoperable health record kind of standards, we still have a lot of work to do with that, definitely. Okay, so as you said, we're plagued by inefficiencies, fragmented systems, interoperability of medical records, very hard. And so that was really the case for your project, to get that together. And so you designed a proof of concept for clinical access utilizing the research hospital staff you have and your familiarity with the service line in a hospital from the front desk all the way to the end, and I imagine you're working on that. And it was to update and improve health information exchange while increasing patient user experience through the utility of Hyperledger Indy, which makes a digital identity. And you were able to do that through a HIPAA compliant path. And you wanted to do that through decentralization and some form of blockchain where I believe we all kind of agree that there are still three pillars of immutability, anonymity, and some kind of distributed or decentralized access to it. So the first paper basically came up with how you're going to put together this identity or passport. And I believe it has to do with a lot of identity and access management. And I brought up in our little summary that protocols like KYC and AML really aren't that appropriate for this process. So why don't you tell us about the 6 Medilinker verifiable credentials that you came up with for the system, or if you'd like to elaborate on the first paper in your own way, if you would. Daniel.
Sure.
Yeah.
So we created we're using a core technology called self-sovereign identity, and so it relies on the fundamental trust that's provided through the blockchain through a peer-to-peer network. And so within that system, we create verifiable credentials, which are data sets that, and then have a wrapper that allows for another institution to understand that is the information within it is has trust, and can be used and shared on to for their use. And so the credentials that we focused in on was first a health identity. It's based on patient demographics. The reason we started there was this project began with a use case where people experiencing homelessness who may actually lose a lot of their hard paper identification. If they lose a backpack, they lose everything that they can use to access healthcare. So creating a digital version that is trustable in a medical setting was the first goal. And so that one includes name, gender, sex, as well as most recent address if they have one, and date of birth for age verification, and so forth. And then the next credential is a medications list. I know it's very complicated to keep track of all the medications people get from various clinics. And so having a centralized list held by the patient that can be shared with another institution can help that interoperability and create that, try to avoid any issues with lack of knowledge during a visit. And then we also have, we create kind of an ecosystem as well. So include an insurance card. So that could be, we use our UT, or University of Texas health insurance card as motivation, but have a digital version that if there was an update, we could quickly send it to all our providers. And then from there, everyone's on the same page. And then next one is a payment. So credit mimics a credit card. So you could have it just like you have on your phone in your digital wallet. You can just submit that information to your healthcare provider. And then if there's a new credit card issued to you, you could share it with the new clinic without issue. The last two, we also have a research credential, which is managing consent. And so where it's unique is that it's actually issued by the patient. So an institution like Dell Medical School could reach out to a patient because to participate in a study. And then the patient would issue the credential to the institution to allow them access to the pertinent information. And then why we reverse that workflow is that if a patient decided to withdraw from the study, they could just revoke that credential. And that there's a documented note on the blockchain saying from this date forward, your data is no longer permitted to be a part of your study. And so it gave power back to the patient. And then the last.
Oh, go ahead. Go ahead.
The last credential was a medical power of attorney. So it allowed, rather than having, or in my case, personal experience, I have elderly parents. And so I kind of I pretend to be them online in order to check into appointments, access records and so forth. In this, with the medical power of attorney credential, I can have an account and then they can give me the medical power of attorney, which is similar to the use case that they find in medical facilities. But when I do a transaction in Medilinker, it says Daniel gave permission for this action on behalf of my parents. Mm-hmm. And so it gives a use case so for geriatric or for pediatric patients so that they're not locked out of the system due to technological or age gap.
Yeah, that's important because that is already people can already access that through, I guess, what you could call legacy systems, but to have that included into a blockchain application is great. And you actually had an application that you created for these patients to, and we'll call them personas. They were actually kind of a fictional patient that went across 7 clinics. And you actually created an application for them.
Yes.
Do you want to speak to that? And it actually, I believe, included a way to update certain records that you had spoken about.
So we created a app. We have a web app that's used in the clinic, mm-hmm. but also a mobile app that can be used in Android and iPhone or iOS.
Okay.
And so, and then that application improve the patient interaction with the system, as well as try to minimize errors in data entry because we could control the type of information going to each field. Mm-hmm. And then it has helped with workflow. And then in terms of for the clinic side, being able to edit the information, reissue those credentials when necessary, became faster with the web app as well as both options.
Okay, that's great. So you also decided, or maybe everyone uses AWS for your virtual machine, which is HIPAA compliant. So there's another layer of security there for you. And I wanted to state kind of your quote, because we're getting to about the halfway point here, is that blockchain technologies can create a transactional identity for vulnerable populations in need of social and health care, such as persons experiencing homelessness, have misplaced their government-issued IDs and paperwork, and Medilinker enables patient populations to hold a secure electronic health ID that is easily managed and recoverable, which is what you just said. But I wanted to state that the Medilinker credentials, I believe you listed about 30 data fields that those credentials can cover. So there's a lot of ways in there to look for errors and redundancy and be able to get a more, let's see, more correct, or I don't want to say, more, a better ID for aggregation at a later time of demographics. So that was, I really enjoyed the thought that there's a research team that is at a hospital and research hospital that's doing this at your level. I think that's a great thing, Daniel. And thank you. So let's move over to Dr. Mustafa Abdul-Moheeth, if he'd like, and he can explain to us improving the transitions of care, designing a blockchain application for patient management. And this is really about interoperability and the outcomes of the first part of this operation, I believe. So I'll let Dr. Mustafa speak to that here real quick. I just wanted to say tasks included for the personas, but we're not limited to clinic enrollment, verification of identity, medication, reconciliation. I think we all spoke about that already, but there were 4 clinics and I believe 3 ancillary clinics, and you had persona patients that went through your system. Tell us how that went.
Yeah, so of course, yeah. So as Daniel kind of mentioned, our work went hand in hand, both designing the technical aspect of Medilinker and its implementation, both informed each other based off of what we do in the real world here. All of the credentials that Daniel mentioned is manifested in some physical form here in the hospital when patients first arrive, whether that be through pharmacy records or pieces of paper that they have, or something that, you know, a patient tells us. All that gets transmitted into an electronic medical record, which, you know, as we've discussed, they're siloed. It's a federated system. So one of the things we wanted to test is to see how in a hypothetical healthcare ecosystem where we do have a blockchain solution for interoperability, would we be able to accomplish a similar transition of care from one facility to another to make sure that patient care is both effective and not a excess waste of resources, because that's one of the major problems. And I think especially in healthcare, you'll realize once you start working on the front lines, there's a lot of redundancy. If I see a patient in the hospital, I do my workup for a specific disease process, I send them back to the clinic. If the clinic doesn't get records of exactly what was done in the hospital, they might end up repeating the same labs or the imaging studies that we already did in the hospital. So with that background in mind, we examined, like you mentioned, some virtual clinics as well as a research center that we all control on the back end, and had our volunteers go through different tasks at each of the clinics. And we followed them along to ensure that they were able to successfully complete these tasks, and that the data that they inputted and that was changed over the visits maintained its fidelity. Ultimately, and we may talk about this in a little bit more detail, in a very controlled system, we were quite successful. And it kind of was a good proof of concept that this technology does have some great potential in healthcare. But with the caveat that our healthcare system is a behemoth, to say the least. There's many different moving parts, many different people involved, and there's actually a lot of like cultural hesitancy to shift in healthcare. It's a very slow moving field as opposed to most other fields in technology and business where there's rapid adaptation to changes. Healthcare, we're very careful, very conservative. And that might be just because of the nature of our work. You're dealing with folks and people's lives, so you want to be extra careful before you change on to anything.
Yeah. Well, I recently heard a speech about how, in some views, a lot of people in healthcare that don't want change quite that fast think everything's working just fine, perhaps. And it is. The system is working exactly kind of how it was designed. Everybody is. I mean, each part of it's working good. The interoperability part, which is what we're trying, or you're trying to address here, is the problem. So I was really let's see. You had 7 clinics, and you were even able to relay the COVID-19 status. Interoperability that the Medilinker provided across the simulated healthcare system had the potential to improve transitions of care. Blockchain technologies appear to face similar tech challenges to widespread adoption, though, as other novel inventions, namely recognition, trust, and usability. I think there's still a big problem with blockchain, and a lot of people haven't decoupled it from crypto, and so they see a lot of that crime going on, or practices like that. And further development and scaling are required for such technology to actually realize its potential in our industry. And it is slowly getting there, and I have a feeling that with projects like these and more awareness of patient ownership and ownership of values and data, that there may be too much pressure on certain healthcare facilities or certain healthcare organizations to slowly adopt this more and more and more, and may even have to accelerate that adoption. And I think the prevalence of the pursuit of the technology is a great idea.
Yeah,
So,
I think you bring up a very good point. As the Internet of Things evolve and we have more and more healthcare wearables and at-home devices, individuals are generating an enormous amount of healthcare data. And they come to the clinic with all this data and tell me, like, Dr. Abdul, I've been checking my heart rate and my blood sugars, and what do I need to do about that? What do I need to do about this? Of course, that's another siloed piece of data that we just have to incorporate into the broader healthcare ecosystem. So in the broader scheme, we kind of talked about in the paper that blockchain does have the potential to incorporate some of this new emerging data as well.
yeah. Gosh, I lost my train of thought there with what you were saying. But basically, kind of right now, from my business experience, I see an out of control system, one that has high costs and kind of not high deliverable quality as it could. So it's almost an out of control system, and contingencies are everywhere in healthcare, and updates are needed. So I wanted to state something to Daniel. Daniel, you had talked about how this was, I think, somehow in your terminology, proof of personhood. Is that something that you kind of used to describe this first part of the experimentation?
So what we've done till now is created digital IDs that can be used. But what we're trying to do next is evaluate whether that data, who the person actually sent that information, is that really the person who is the actor?
Right.
And so, because that's the next kind of an authentication leg. You got the data, then you need to prove the personhood, and then you can establish the trust. And so we're working on a liveness test currently that when data is submitted from a patient's wallet, a patient's picture is part of that identity, and then a stream, you can send a credentialed picture of yourself or have a live stream with the nurse or the receptionist. And then with those pieces of information, the trust can be verified, at least on a visual inspection. We can make this automated later, but at the moment, we're just trying to prove the actors are not a bad actor. And so,
Sure. And I've always kind of thought in my mind that a proof of humanity, a proof of personhood would require some kind of human input as well. Like someone needs to see you, or some kind of personal interaction has to happen, because we know there's deep fake bots and all sorts of things right now that would love to take somebody's identity. So
we're
go ahead.
also exploring another concept, which is high and low assurance as well. And so
Okay.
certain items such as your medical record, or if you have a highly sensitive medical part of your record, you will need to prove who you are in real time before you send it. However, sharing your insurance information or verifying insurance information, you could probably share it with just a picture. So given the circumstances that you have, or the use cases that the workflows that you're in, we can ratchet up the necessary trust in order to proceed and further on the steps.
Great. Well, we just have a couple minutes left, so let's go into the conclusions here for you guys for these tests. I wanted to quote the end of the second paper, a little quote that said, user perception of blockchains after use. In fact, a large majority of participants felt more in control of their medical data using Medilinker, indicating that perhaps increased exposure to blockchain technologies, like Dr. Abdul-Moheeth has said, and education about their functions may improve public perceptions and acceptance of such novel technology. So the people who controlled the personas felt that it became an easier process, and all they really needed to do was become familiar with it. And to use these apps that you had created was natively, they were able to use them quite easily. From what I see, we had a high level of lean management, 97.50 accuracy for medication credentialing, 97.78 for insurance credentialing, and 97.5 for insurance payment. Used the Medilinker system found to be very easy to use by most respondents. You want to speak to those results at all? Perhaps either of you?
Yeah, sure. With healthcare in general, it's a partnership, right, between physicians and their patients. The physicians can do everything they can on their end, but ultimately everyone has to take a little bit of ownership over their own care, making sure you take your medications, do the right therapies, and so on and so forth. Being exposed to technology that kind of brings your healthcare closer to you, I think allows people to feel a little bit more ownership over their healthcare that can potentially, improve their health as well. So that was, there's a lot to talk about that when it comes to patient engagement. And I think this is just one additional benefit that, technology such as this can have in the delivery of healthcare.
Okay.
In terms for the participants found more control in their healthcare and their data record, we had two major features that really influenced that. And one is the revocation. So if you have a bad experience at a clinic and you just, I don't want to have any association with this clinic, you can revoke their access to your data. And then just say, I don't want you to use my data anymore. Now they have possession of a copy, maybe in their EMR. We can't do anything there, but there's a record in the blockchain saying from this date forward, you are not allowed to use my information.
Oh, okay.
And then the other part is that we also have granular consent and no knowledge proofs. And so, for instance, I got referred for an orthopedic procedure. They don't need to know half of that 30 data elements. They need to know my name and maybe the immediate referral to them. You can share just those pieces of information as you wish to the clinic. And so that gives a lot of control to the patient. But also there are things like age, or that you need to prove that you're over 21, but I don't want to share you my exact birthday, for instance.
Yeah.
We can do that with blockchain, as with the credentialing, we can prove things without having to share them as well.
It's so you're saying they can actually maybe anonymize certain data fields if they'd like, or
if a patient, if there's a certain amount of information that's required, a patient doesn't have to give everything to the institution. They can control what they want to and go forward. And there is a flip side to that, is that a patient may hide some things, but it's on the patient is the owner of their data. So the patient should have the right to share what they feel is appropriate.
That just actually made me think of a thought. And in healthcare, I always encounter patients that don't think that they need to share certain information when physicians and providers think that they do. From one thing, in radiology, people won't say that they had surgery. And it's like, why didn't you say you had surgery? We need to use contrast now, you know? So there is that, that can backfire a little bit there, I suppose, for the patient if they're not really aware of that. And so, yeah, go ahead.
So for that workflow that you described, which we've done in our study, is the institution can request the proof. So they can request the pieces of information that they need to proceed forward.
Gotcha.
And so it gives a little guidance to the patient of what information would be necessary.
Okay.
And then it's up to the patient to share that information. If there's something that they don't want to share, they can maybe pick up the phone, do it in person. Like there's ways a clinician's office can get that information if they really needed it. But the patient in the end is the one that hits the go button to say share.
Okay, great. Okay. Future research. Daniel, if you'd like to speak to that at all.
So we are, in our project, we've done health identity for the last 2 or 3 years, and proving liveliness and proving and trying to get the workflows that Dr. Moheeth is designed. Well, the next step is to create a patient-centric medical record that uses FHIR and integrates with EMRs, so that a patient, the real medical record is patient held. So I'll just use a visual example. My father goes to 5 different clinics, and in order to keep all that information straight, I have these. So as opposed to having to write all that down and then be able to recite it to them, we could have that all be in his account on Medilinker, and then he could share it to the next institution and keep all those doctors on the same page and seamlessly manage that data liquidity between his primary care physician and his other specialties. And so that's our next big step forward. Okay.
Well, I look forward to hearing about that. And I think I saw another paper come out that I missed. Is there a third paper that I just missed in the blockchain in healthcare today? Maybe
yes.
Okay.
Actually, fortunately, the author of that paper is in the call today.
Mustafa. Okay. Robert Batista. Okay. Okay. Well, I look forward to reading that and looking a little bit more into that. And perhaps I'll see you in September in Austin, Texas, for the conference for Blockchain Healthcare Day.
Sounds
If
good.
you get a chance to stop by. Okay, you guys, any final thoughts before we have to go here?
Thank you for
Questions?
giving us this opportunity. This was really nice to share some of our work, and we're looking forward to seeing the next half decade will bring. It's a really exciting field.
Great. I agree with you. It's really exciting. Yeah. Okay.
I'd like to
All right,
echo, thank
Go.
you so much for the opportunity. I think blockchain has a lot of opportunities outside of fintech and outside of cryptocurrency. And I think they're starting to bubble up to the surface now through the literature. And so we're at the beginning of something that could be fundamental in the future. So thank you for the opportunity to speak.
Absolutely. And I think it's key to healthcare too. So, all right, guys. Well, enjoy your day. And I hope to speak to you soon and stay in touch. Okay. Thank you, everybody. All right.
Thank you.
Thank you.